And welcome back. February is American Heart Month, and it's a time for people to really focus on their cardiovascular health. Now, 1 in every 3 adult Americans has high blood pressure, many more at risk of developing it. Our next guest is here to discuss what you can do to minimize risk and also keep your blood pressure under control, particularly at a time like this. We're pleased to be having joining with us the RN at VNSNY, Ms. Denise Simmonds. And Denise, good to have you here on the show. And I'll start off by saying that as the numbers continue to rise and we see more people seeing high blood pressure become more prevalent in their lives, we know that sometimes this is attributed to age.
That is true. That is true. Thank you for having me. Yes, it is. But it also is a disease that affects the young as well as the elderly. It doesn't discriminate.
Yeah. And so for people who don't know about cardiovascular health, high blood pressure, what is, for clarity's sake, a good blood pressure number to have?
So a good blood pressure number to have, it's important for people to develop and to maintain a relationship with their doctor. The number is very individual. Very often we'll go in and say 130, 120 over 70, 80. The lower, the better that you can tolerate it, but it is important to be monitored by a doctor, a healthcare clinician, to help develop those numbers, just as you would any other health condition. There's not a magic number that fits all.
So it varies by age, and people have to pay very close attention monitoring it. What are the signs of high blood pressure?
So very often there'll be some swelling, there'll be some fatigue, there'll be some headache, very vague. But again, it is known as the silent killer. And it's not something that people say initially, this is my high blood pressure. But certainly if you start to notice some swelling, some fatigue, headache, it's certainly something to discuss with your doctor.
And we know as we're in February, it is African American History Month, and this is intact with African American history because history suggests that when it talks about hypertension, we find it to be more prevalent in communities of color.
That is true. That is true. Historically, it is. There are a number of factors. There are the food, there's education, there's exercise, there's rest, there's stress. And there's also compliance with going to medical providers. You know, we don't necessarily go to the doctor. We try to find every way around going to the doctor to seek the help that we need before it very often is a condition that could have been managed very early on. So with prevention in the community, trying to manage our diet, trying to manage our stress, trying to get enough rest, following up with medical providers, it's all very important to manage the condition.
You gave us some right there because those are some of the tips that I guess you would give to anybody in terms of really dealing with that. But also, how big is diet when we talk about blood pressure?
Oh, diet is one of the main factors. Living in the Bronx, there's access to so much food, and yet still live in a food desert. Regardless of where you are, there's such easy access, and it's not necessarily food that we need to eat to support our body, to support our health. It just feeds our body, but it's not nourishing our body. So our foods may be very often fried, highly processed. They're not the best options that are immediately available. So certainly making a conscious effort to buy things that are low in fat, that are green-based, limiting carbohydrates, cooking at home more, no matter how simple it is, just preparing a simple meal at home, that makes a big difference in managing high blood pressure.
So my visit to the doctor, he told me fast food and fried food are just two of the bad things that you have to try to avoid. And I've done better in the area of fast food. I'll tell you about the fried food later on. But I believe that those are also two of the big things that I heard, particularly in terms of trying to curb health, or I should say curb your blood pressure.
Your doctor didn't stir you wrong. Your doctor told you the right thing. He told you the right things. A wise doctor. Listen, definitely fried foods. It's easy, it's inexpensive, but it's not the best options. It's what we're used to. It's not that we have to give it up altogether, but on occasion, we have to determine for our health and our wellness, if it's worth it. Should I eat this every day? You know, when these young people are coming home from school, you know, should I stop and get fried chicken or French fries every day? No, you know, pick up a piece of fruit, you know, buy a small salad. It's okay. It's okay. It's all right to have it on occasion, but try to just change from our mind to change the way we think and the way we behave to implement those behaviors. It's very important in managing high blood pressure and health overall.
How important is exercise? I think I'm just going to throw you the beach ball there and let you hit it. But how important is exercise? Because I think so many times we think that we have this full, hard workout regimen that has to get us to a place of really lowering our blood pressure, but that's not always the case.
Just move, just move, just move, just do something. Just get out and do a simple walk. Just start small steps, baby steps. You eat an elephant one bite at a time. How do you get to accomplish great things? One step at a time. So simply moving. A gym is great if you have the financial resources and if you have the time, but if you don't, if you're able to, we're building, take the stairs, and get the mail and take the elevator up. And if you live way up in a building, maybe coming off on the second floor and then walking down and up one flight of stairs, but just get it in a little at a time, a little at a time. Do what you can. Set realistic expectations to support your goal.
And if one is diagnosed with high blood pressure, talk to me about what are the treatment options, because I think sometimes people have an aversion of even going to see the doctor because they have a fear for how bad those treatment options may be.
So treatment for diabetes, like anything else, it's multifaceted. It's definitely going to the doctor is the first step. It is the first step, and it's to be commended. And once your doctor diagnoses and says, we have an issue here with that, we have an issue here with high blood pressure, it's not to shake it off and say, well, the doctor says I have high blood pressure. However, I feel fine. This is the thing with blood pressure. We very often feel fine. We walk around, but inside is a ticking time bomb. So it's to understand that my blood pressure has been elevated, to understand and work with your doctor or your nurse to understand what are the factors that have led to the doctor saying to you, your blood pressure is high. Is it my diet? Is it my rest and work activity balance? Is it my activity level? Is it my stress? Are there other factors such as smoking that are contributing to this diagnosis? And although I feel fine, understanding and accepting when your doctor says that this high blood pressure, you may not feel it at this time, but it is working in your body. It is causing certain problems in your body. And with the interventions that myself and a nurse will teach you, if you integrate them, it can help to manage the condition so that you can live well. So again, as we spoke about, there's diet and exercise, and then there are pills that the doctor can start with, of course, to support you. And one of the biggest things is once you get your medication, it's not a one size fit all. It's not going into the store and buying shoes and they're going to last forever. You're not going to be a size 9 forever. It's a continuous relationship with your doctor to understand that you have the right medication at the right dose to support wellness. Because again, the doctor said it, but it needs to be monitored to know how well your medication is working for you, along with your behavior modification.
And very quickly before we go, I got to leave on this point. Just because you're on high blood pressure medication doesn't mean that you have to stay on high blood pressure medication, correct?
Not necessarily, not necessarily. So remember, behavior modification is one of the biggest factors. So continually changing your behavior, as we've previously as we have previously spoken about, is key. And then also adding your medication to the regimen, keeping up with your doctor's appointments to know how your behavior and the medication is working for you. If you have improvement in your stress, in your rest, in your activity, in your weight, your doctor may say, listen, this is fantastic. We have reached a point where we can reduce or even eliminate your medication. It is possible, but you have to keep up with those good behaviors that you integrated, right? To stay off the medication and continue that relationship with your doctor. Life changes. We fall off the wagon from time to time, right? So we have to stay in that relationship with that doctor to support us in our journey.
Well, Denise, after 21 years in the business, we consider this very sound advice. Thank you so much for being with us and sharing with us here on Open as we talk about cardiovascular health. Thank you so much for being with us.
Thank you for having me.
All righty, and I want our viewers to know, if you want more information, this is a very important topic, and particularly for those in the African American communities, we know that hypertension is something that affects many in the community. It's encouraged that you get information. So if you want more, visit the website, vnsny.org, and then also call them at 1-800-675-0391. We encourage you to stay with us. Don't go anywhere. Open continues coming up after this short break.